Hello and welcome to our channel. Today we're discussing a very important topic, relieving joint pain and osteoarthritis with turmeric. Thank you for being here, and if you haven't subscribed yet, please do so and give this video a like. This helps us reach more people who need this valuable information and encourages us to continue producing more high-quality content like this. Osteoarthritis is a condition that can turn simple movements into painful challenges, and finding effective and natural ways to manage this pain is essential. In this video, we will explore how turmeric, the famous golden spice, can be a powerful ally in this process. We'll discuss what osteoarthritis is, the scientific evidence supporting the use of turmeric, how it compares to traditional medications, and how you can effectively include it in your daily diet. Stay with us until the end to discover all the tips, and also learn about other care strategies that can improve your joint health. Imagine a small, vibrant golden root full of ancient secrets. This is turmeric, a hidden treasure that has been a jewel in the crown of traditional Asian medicine for centuries. Originating from the curcuma longa plant, this spice offers more than just the ability to color curries. Its active component, curcumin, is the true hero behind the medicinal benefits that modern science is increasingly validating. This substance holds a powerful arsenal of antioxidant and anti-inflammatory properties that act as a protective shield for the body, combating free radical damage and reducing inflammation in the joints. Osteoarthritis, a painful condition that wears down joint cartilage, can turn simple daily tasks into significant challenges. This is where turmeric steps in as a potential natural solution. Studies indicate that curcumin can help alleviate the pain and inflammation associated with osteoarthritis, offering a promising alternative to traditional medications. It's fascinating to think that something as simple as a spice could have such a significant impact on quality of life. The impact of turmeric on osteoarthritis isn't limited to immediate pain relief. Curcumin works deep within the body's inflammatory pathways, potentially contributing to continuous improvement in mobility and joint function. Imagine walking, bending your knees, or even opening a jar with less pain and more confidence. This is the potential turmeric offers, making it a valuable ally in the fight against osteoarthritis. What is osteoarthritis? Osteoarthritis is like a silent villain that over time wears down the joints of the body, turning what were once natural movements into sources of pain and discomfort. Also known as wear and tear arthritis, this condition is most common in older adults, though it is not exclusive to them. Over the years, the cartilage that acts as a cushion between bones starts to deteriorate, leading to direct bone-on-bone friction. This results in inflammation, pain, and stiffness in the most used joints, such as the thumbs, fingers, shoulders, knees, hips, and spine. Picture someone trying to stand up from a chair or walk to the kitchen, feeling every movement as a challenge. This is the reality for many suffering from osteoarthritis. The symptoms of this condition tend to worsen with movement, especially after prolonged periods of inactivity, like after waking up in the morning or sitting for long hours. Interestingly, the weather can also influence the intensity of the pain. Cold and damp days often exacerbate symptoms, while warmth can provide some temporary relief. For those facing this condition, finding ways to relieve pain and improve mobility is crucial. Rest is a temporary solution, but using heat therapies, such as heating pads, can help relax the muscles around the joint and reduce stiffness. While there is no cure for osteoarthritis, managing the symptoms is possible with a combination of treatments and lifestyle changes. Scientific evidence on turmeric for osteoarthritis. Modern science has been dedicating itself to investigating the therapeutic potential of turmeric, especially in the context of osteoarthritis. Recent studies have shed light on how this ancient spice can offer more than just flavor to dishes. In 2018, a meta-analysis reviewing 69 studies on nutritional supplements for osteoarthritis highlighted turmeric as one of the few that demonstrated significant impact in reducing pain and improving joint function. These studies indicate that curcumin, the active compound in turmeric, could be a viable alternative for those seeking to alleviate osteoarthritis symptoms without resorting to conventional medications. A randomized controlled trial published in 2020 provided even more evidence in favor of turmeric. 70 patients with knee osteoarthritis were followed over 3 months, receiving daily doses of 1,000 milliliters of turmeric. The results were encouraging. The patients who took turmeric reported a significant reduction in pain levels compared to those who received a placebo. However, it is important to note that the accumulation of fluid in the joints, a common symptom of osteoarthritis, remained unchanged, suggesting that turmeric might be more effective in managing pain than in resolving all aspects of the disease. These findings are promising, but as any good mentor would advise, it's essential to look at the bigger picture. Turmeric shows real potential, but it should not be seen as a magic solution. Integrating it into a broader treatment approach that includes physical exercise, a balanced diet, and of course professional healthcare guidance can offer the best results for those seeking to improve their quality of life while living with osteoarthritis. Comparison with nonsteroidal anti-inflammatory drugs, NSAIDs. In a more recent study published in 2021 involving 200 patients with knee osteoarthritis, the effects of curcumin were compared with those of nonsteroidal anti-inflammatory drugs, NSAIDs, specifically diclofenac, one of the most commonly prescribed NSAIDs. In this double-blind, randomized study, patients were divided into two groups. One group of 100 patients received 1,500 milliliters of curcumin per day, while the other group of 100 patients received 50 milliliters of diclofenac daily for 12 weeks. The results showed that both groups experienced significant reductions in pain and joint stiffness. However, the group taking curcumin reported fewer side effects, with only 5% of participants reporting gastrointestinal discomfort compared to 28% in the diclofenac group. Another study from 2022, with an even larger sample of 300 patients, compared the effects of curcumin with ibuprofen, a widely used NSAID. In this clinical trial, participants were equally divided into three groups. The first group received 1,000 milliliters of curcumin, the second group took 400 milliliters of ibuprofen, and the third group received a placebo, all daily for 6 months. The results revealed that both the curcumin and ibuprofen groups showed similar improvements in mobility and pain reduction compared to the placebo. However, the group that received curcumin reported a lower incidence of side effects, such as digestive issues and dizziness, affecting only 8% of participants, compared to 23% in the ibuprofen group. These recent studies reinforce curcumin's potential as an effective and safe alternative to NSAIDs in treating osteoarthritis. The low incidence of side effects, combined with comparable efficacy in reducing pain and improving joint function, makes turmeric an attractive option for those seeking a more natural and less invasive treatment for osteoarthritis symptoms. However, it is always important to consult a healthcare professional before making any changes to treatment. Recommended dose and considerations for turmeric. For those who prefer to obtain the benefits of turmeric more naturally, incorporating this spice into your daily diet can be an excellent option. Regular consumption of turmeric in dishes like curries, soups, and even beverages like the popular golden milk is a tasty and effective way to integrate this powerful root into your diet. Studies suggest that consuming about 2 to 4 grams of fresh turmeric, or about 1 to 2 teaspoons of turmeric powder per day, can be sufficient to provide significant anti-inflammatory and antioxidant effects. However, just as with supplementation, the absorption of curcumin, the active compound in turmeric, is critical. When consumed through food, combining turmeric with black pepper, which contains piperine, can significantly increase curcumin's bioavailability, making its effects more pronounced. Additionally, consuming turmeric with a fat source, such as coconut oil or olive oil, can also aid in absorption, enhancing its benefits. Incorporating turmeric into your daily diet not only adds an exotic and vibrant flavor to your meals, but can also be a powerful ally in promoting joint health and preventing inflammatory diseases. However, as with any dietary change, it is important to observe how your body responds and adjust quantities as needed, always maintaining a healthy balance. Turmeric, with its rich tradition in natural medicine, is emerging as an effective option for relieving joint pain and osteoarthritis symptoms. If you are looking for alternatives to conventional treatments, including this spice in your diet can be a wise choice. Besides adding flavor to your meals, you will be promoting your health in a simple and natural way. How about starting today to experiment with turmeric in your kitchen? Whether preparing a flavorful curry or a soothing tea, the options are many, and the benefits even more. And if you want to learn more about how to take care of your joints naturally, don't miss our recommended video, How to Reduce Uric Acid and Heal Arthritis. There, you'll find valuable tips to complement what you've learned today. Don't forget to subscribe to the channel, activate notifications, and leave a comment sharing your experience or questions. Thank you for being with us until now, and I look forward to sharing more valuable tips with you in the next video. Until then, take care and keep investing in your health.